start putting in your names and your student ID number in the chat box, if that's okay. I need that for attendance purposes. So I'll take the attendance, a snapshot of your attendance at the end. And I'll also request you to please write your names in the chat box provided on Zoom. So yeah, we should start this now. Thank you in advance. I hope you can see my screens. Good morning, everyone. Dr. Anita here. Yeah, good morning. So we had so far, what we were doing was that, just a minute, my highlighter on. So we were talking about the structure and overview of health and social care sector. And we were trying to understand the structure of health and social care provision. So this was the UK that we were talking about, and we were talking about the NHS. So we had completed quite a few slides. There were some bits that needed explanation. Go ahead and stop there. So yeah, so we were trying to talk about, I'll just mute you all if that's okay. Good morning to everyone, whoever's joined for the first time. Yeah, I'm Dr. Anita Koso, and welcome to the session. So yeah, we were talking about the health sector and the social sector as well within the chosen country, which was the UK that we were talking about. So the health expenditure in the United Kingdom, this is for June 28th, 2021. The healthcare expenditure or the spending in the United Kingdom, it has gradually increased since 1997. And so it amounted to 65 billion British pounds. And by 2019, healthcare expenditure in the UK stood at 225 billion pounds, British pounds. And this was an increase of 13.1 billion British pounds on the previous year's healthcare expenditure. Any idea what happened here? What was the reason? Can anyone comment on this steep graph that went up? Anyone? 2019. So this increased 13.1 billion British pounds. Anyone? You can unmute yourselves and talk. You can write it in the chat box. Please start writing your student name and your ID here. Your name and your student ID here in the chat box as well. So it happened because of COVID-19, remember? 2019. So that rise in healthcare expenditure happened because of COVID-19, which we're all aware of. Then employment, so the number of people employed in the health and social sector in the United Kingdom in 2020, so there was changes in them as well. So in 2020, there were approximately 1,840,000 people employed by business in the health and social care sector in the United Kingdom, and there were 474,000 people employed in business that employed 500 or more people. Because obviously when COVID-19 happened, you had to employ more people because there were a lot of people dying. You had to save those people from deaths, from dying, those people who were vulnerable or in hospitals. But then there were doctors and nurses and healthcare staff who was dying as well. So they had to be replaced as well. Then the percentage of gross domestic product, the product that is produced within the country. So healthcare spending in the United Kingdom as a share of the GDP, it has increased since 1997, where it was 6.8%. By 2019, healthcare expenditure in the UK amounted to 10.2% of the GDP. Okay, so this graph shows you how much increase was there, and most of it was because of healthcare, and it was in general experienced an increase over the provided time interval. So GDP, we know the value of goods produced and services provided in a country in 1 year. So the amount of the money that you generate within the country, that is known as gross domestic product. Then we go on to describe the provision compared to population. So in 2017, thank you, Tayo and Joshua. In 2017, the UK spent approximately 3,000 per person on healthcare. And this was around the average for members of the OECD countries. And UK healthcare spending per person was the second lowest, with the highest spenders being France. So the highest spending was France, Germany, and the United States on healthcare. So UK healthcare spending fell from 9.8% in 2013 to 9.6% in 2017. And it's the NHS-based healthcare system. It contributes to the UK having one of the highest shares of publicly funded healthcare, 79% in OECD. We talked about it yesterday that most of it comes from our taxes, okay? So in 2017, UK spent the equivalent of £560 per person on health-related long-term care, and which was less than most other Northern or Western European countries. A similar amount to France and Canada. Okay. Now coming towards the state funding. So the NHS is mainly funded from general taxation. We know that, supplemented by NI contributions. In England, Wales, and Scotland, local authorities are responsible for adult social care, and this duty is set in law. Funding comes from central grants, and this can be subject to squeezes from central government and from the council tax on property. So taxes that change, they vary, so things can vary as well. Private health insurance we were talking about yesterday. So it's a type of insurance that covers the cost of private healthcare in the United Kingdom. It's similar to other types of insurance where you pay a monthly or annual premium, and your insurer will pay for some or all of the cost of private medical treatments that you receive. This is another way to get healthcare. NHS relies on charities as well. So 250 NHS charities work across the UK. Most of them focus on helping hospitals to do more. And collectively, these charities give around 1 million every day to the NHS. So that is why we see so many charities going on here. In the recent years, NHS charities have funded major capital projects, pioneering research, medical equipment at our hospitals, helping patients access the best possible care when they need it most. And they also play a key role in mobilizing volunteers to support the NHS staff. There's brightening wards and waiting areas with colorful and engaging art. And they're making it very presentable and very livable for people who have to stay there for longer periods of time. Other NHS charities support mental health trusts, community health trusts, and ambulance trusts. So all of this is based mostly on charities and taxation. So healthcare and social, health and social care, sorry, I forgot to record this session. Am I recording it? Yeah, no, it is recording, sorry. Health and social care spending. This where does the money go? So in 2015 to 16, the UK public sector, it spent around 220 billion on health and social care and benefits to support people with disabilities and health conditions. And this is equivalent to 11.5% of UK's national income and 28.7% of the total public spending. So this is a huge chunk, okay? So the majority of 140 billion or 63.9 or almost 64% of this was spent on health. So there was benefits that got 49.7 billion pounds and social care that received 29.9 billion pounds. New forecasts from the Office of Budget Responsibility, OBR, has been released in 2017 that indicates that rising demographic and cost pressures could result in 14.7% of national income needing to be spent on health and long-term care by the years 2066 to 67. How do we regulate healthcare? So here we learn about what is the process of regulation in healthcare. Okay, so because this is a huge project, it's a huge sector, health and social care sector. How is it regulated? So regulation, it plays a very major role in healthcare industry and healthcare insurance coverage. The various regulatory bodies, they protect the public from a number of health risks, and they are there to provide numerous programs for public health and welfare. And altogether, these regulatory agencies protect and regulate public health at every level. So which organization inspects? So there are different organizations that inspect and regulate the health and social care industry. So there's CQC, which is Care Quality Commission, which was established in 2009. So it is the independent health and social care regulator for England. And this is responsible for registration, regulation, inspection, and rating of all the providers. So CQC, what objectives does it have? It can close down organizations if they're not working properly, if they're not working according to their objectives. So the CQC's main objective is to protect and promote the health, safety, and welfare of the people whose health and social care services they're providing for. And its remit includes both the NHS and the local authorities, as well as the independent providers of health and social care. Okay, so these are the main objectives. So as we know that they are focused more on the improvement of health and social care services, and they do it on a regular basis, these checks and balances. Provision of health and social care services in a way that focuses on the needs and experiences of people who use those services, and the efficient and effective use of resources in the provision of health and social care services. Other regulatory bodies exist as well. So there's HCPC, which is Health and Care Professionals Councils. You have whose role is to protect the public. So you have the GCC, where it regulates chiropractors. The General Dental Council, you have where it's mostly involved in dentistry. The GMC regulates the doctors. You can't work as a doctor if you don't have a GMC regulation. So other organizations include General Optical Council. As the name implies, it is for opticians and optometrists. And General Osteopathic Council, GOC, and the Nursing and Midwifery Council, which is NMC, and the Health and Care Professionals Council, HCPC. You have art therapists, biomedical scientists, there are podiatrists, there are clinical scientists, there are dietitians, and the list goes on. There's General Pharmaceutical Council, there's the Pharmaceutical Society of Northern Ireland Social Care Council, Social Care Wales, you have Scottish Social Services Council. Okay, so this is a cutting taken from your article snapshot. Just have a look at it. It's there on your Moodle website as well. So public spending on health and social care, it's been mostly on adult social care in England. So most of it, if you see in this pie chart, there's most of it there is utilizing disability benefits. And then there's, which accounts for 17.6 billion pounds. And then there's local authority adult social care, 16 billion pounds. Incapacity benefits, 12 billion pounds, and benefits for carers, which is 2.8 billion pounds. The Department of Health and Social Care's budget. So if we see, there's a spike over here in 2021, 20 to 2021. So the budget increased. So from 150, it increased 63%, okay, to 220 billion pounds, almost touching that. This is from the King's Fund. So this was obviously because of COVID and its impact. Current funding for health services in England comes from the Department of Health and Social Care budget. And the planned spending for the Department of Health and Social Care in England was 212.1 billion in 2020 to 21, up to 150.4 billion in 2019 to 2020. This is all again because of the COVID-19 pandemic. This is all because of it. So we now analyze how health and social care spending happens in the in your country, in the UK. So most of the department's core budgeting, excluding COVID-19 spending, it's revenue funding for spending on day-to-day items such as staff salaries, you have medicines. The remainder is for capital spending on buildings, equipment, and other necessary items. So the rest is allocated to other national bodies for spending on other health-related functions such as public health, training, development of NHS staff, and regulating the quality of care. Thank you for putting your attendance in. Okay, so recent changes to funding. There have been some recent changes during his period of austerity. They followed the 2008 economic crash, which we experienced in the United Kingdom, and the Department of Health and Social Care budget continued to grow, but at a very slow pace compared to previous years. And budgets rose by 1.4% each year on average, adjusting for inflation in the 10 years between 2009 to 10 to 2018 to 19, compared to 3.7%, which is huge rises as percent average rises since the NHS was established. And then we go on to the 5-year funding deal. So we have deals that go on for some years. So in 2018, July, the Prime Minister announced a new 5-year funding deal that would see NHS funding rise by 33.9 billion in cash terms by 2023 to 24. And this is compared to the years earlier, 2018 to 19. And it's still not efficient enough or sufficient enough. Okay, so it needs a revamping again, which will happen soon. So then there was manifesto commitments and COVID-19. There have been several increases to health spending since the 5-year NHS funding deal was announced in September 2019 spending round. The government announced increases in budgets for capital investment and the public health grant and the education and training budgets. So obviously they needed more staff, they needed more funding, they were getting patients unprecedented. So you can have a look at all of this. I'm not going into details. These are a bit more in-depth spending within the UK during COVID-19. We've talked mostly about it. Mostly it was because of vaccines and the deaths that were happening there, the complications of COVID-19. So that's it for this session. The first session. I'll quickly share the second learning outcome with you. Those who have joined just now, welcome. I would appreciate if you could just mark your attendance here and in the chat box that has been on Zoom. So I just have your record of your attendance. We'll quickly go through. I won't keep you for long today. Because we're done with the first learning outcome. That's okay. We'll touch upon the second learning outcome. I'll just share my screen with you. Any questions in between, please let me know. Please feel free to ask any questions in between. I'm happy to take them. If I don't know the answer, I can come with an answer next time. So this is the second learning outcome where we understand health and social care provision for different ages and stages of life. We know that we go through different ages and stages in life. So there's the human life, it varies. Okay, so there's different people. Obviously, there's an infant who is born, he is weak or he or she is weak. In the beginning, they begin to grow. they're growing in, and then they hit the stage of toddlerhood, then their puberty comes in, and then there's adulthood. So there are different events that take place and shape us into individuals that we become in the later years, and the variety of factors that affect individuals and their development, both positively and negatively. Yeah. So the provision for different ages and stages. So working in health and social care sectors, you will care for people and they'll be from varying ages and they'll have different personalities. Some of them will be vulnerable, some will have disabilities. So there's a various mix of people. You won't get the same people every day. So there's this outlining the points at which health and social care provision may be required during a lifetime. So the key stages are defined by the World Health Organization. The state of physical, mental, and social well-being, which is complete. Okay, so it's a complete state of physical. So you have well-being, which is both three tiers of well-being. So it's physical, mental, and social well-being. And it's not only the absence of disease. So initially, it was mentioned by the World Health Organization that whoever doesn't have disease is considered as healthy. But no, now you have to be physically, mentally, and socially in a well-being state. You should be well enough to be called as having no disease or being healthy. So it focuses not only on reducing mortality and morbidity, but also on the impacts of health determinants, the economic, environmental, and social conditions on health and well-being at various stages in life. Now we go on to outline at which health and social care provision may be required, which stages. So the ages and stages in life. So there's infancy that we start with, when the child is born, up to the age of 1 year. Early childhood, adolescence, early adulthood, and later adulthood. All of these stages need different requirements. So infancy and early childhood. So you have a midwife, a healthcare professional who is trained to support women during pregnancy, childbirth, and early postnatal stage. Midwives, they're also responsible for delivering the information that is listed below to women and their families. So what information it is? So they also promote care of 0 to 2 years old children. So examination and monitoring. So the fetal well-being assessment is done, undertaking screening tests and keeping records, prenatal care at home, in hospitals and in surgeries, providing practical and psychological support for women and their families during childbirth, supporting families during pregnancy to prepare for parenthood, providing support in cases of bereavement, and training and mentoring students, midwives, and others. So all of these are provided by the midwife. And then we come to early childhood, where you have the health visitor, you have family support workers, you have family assessment as well. So here you have health visitors who mostly work in the community with the children up to 5 years of age and their families. So their health visitors work alongside school nurses, doctors, social workers, and other health professionals, and they work from homes, clinics, or surgeries, and they provide family. You have family support workers. As the name suggests, they provide support to the families. They can support children's educational attendance. They provide work support. They provide care support. And then there's family assessment. So all of this happens during early childhood. So for family assessment provides an opportunities where you get to know, they get to know the whole family in a better way. And this is all to support them and the family and the child's health as well. And then there's adolescence. So there's support through adolescence, where you have school nurses, you have social workers, you have community mental health teams. So children and young people, they progress through a number of transitions. So this is a very vulnerable time during between ages 10 to 14 years, from primary to secondary school. And this can also provide an opportunity to provide advice to support positive health choices and behavior change. There's substance misuse also, which is very rampant during these ages, unfortunately, but there's support as well for that. So the local authorities, they invest in substance-related service provision across different levels and of needs, and from schools targeted provision with groups vulnerable to drug use and specialist services treating young people's substance misuse. Then in adolescence, you have mental health well-being. So this is mostly for the most recent data shows that 1 in 7, 11 to 16-year-old children have a diagnosable mental health disorder, which is very, very disturbing. So you have teams to support that as well. You have homelessness, which is a devastating experience for a family. So it can have all sorts of consequences on you. So there's support for that as well. Then childhood obesity and physical activity. So there's public health teams that work on them, and they pledge to provide them with the latest tools so that they can help children, young people, and families with their weight. So I would now stop here, and because we've gone through a lot of stuff already. Any questions so far? So these, the rest bit we will do next weekend. So we've talked a bit about till early childhood and adolescent stages. Think we can go till adulthood as well. Just a minute. So yeah, we can go till adulthood as well. So yeah, because we're adults, so we don't want to miss our bit, isn't it? So early or mid adulthood. So we have different problems during those life changes as well. People have their jobs, people lose their jobs, they're looking for jobs, they're getting married. But there's always change that's happening. Sometimes it's good, sometimes it's not very good. A lot of women who have postpartum depression can understand that. You can have a loss of a relationship or a loved one because obviously you're growing older, so your older people are growing even more older. So there's support during those times as well. So there's when this happens, there's difficulty coping with emotions. You have anger, you have sadness, anxiety. You can fall into traps of alcohol and drug abuse, academic or employment difficulties, family discord, parenting issues. You can have marital issues, difficulty in finding a good romantic partner. You have financial stresses, spiritual issues. So treatment can help you in various ways to improve your conditions. You have psychiatrists, psychologists, and licensed therapists for that. So we are considered in late adulthood from the time we reach our mid-60s until the time we die. Because we are living longer, late adulthood is getting longer now. So a 10-year-old child today has a 50% chance of living to the age of 104. And then there's support services. So you have home help, you have handy person services, foot care, transport, dementia support, exercise classes, and social activities going on. The NHS also provides access to a variety of services such as social care workers, community nurses, GPs, you have dentists, you have hearing and optical care. Care homes and carers were required. Okay, and then you have maternity services apart from them. So this is apart from the stages of life. So you have maternity services, you have pregnancy tests, you have routine checks, delivery checks. Then there's childcare support as well. So family support where they can look after your child. There's daycare for children, help with parenting. There's parenting classes, courses on family support, practical home help, and access to a child center's support service. Okay, so I'll end here if that's okay, and we'll do the rest bit next weekend. Yeah, that's okay. I'll appreciate if you could wait a minute so I can just take your attendance. I'll